Breaking news tonight, market meltdown. As the coronavirus spreads, stocks take a nosedive.
This is fears of the coronavirus spread. More schools and universities suspend classes.
Also developing tonight, at least 3 new deaths reported in Washington state, the nursing home crisis there.
These are the headlines you've been seeing as concerns grow about the coronavirus in the U.S. Today, we're breaking through the noise to get the details you need. What you should know about the virus, how you can protect your family, and what's being done to find a treatment. This is Coronavirus, the Facts. Welcome to Coronavirus, the Facts. I'm Chris Stewart in Omaha, outside the University of Nebraska Medical Center. This is a facility where coronavirus patients have been quarantined and doctors have been working on treatments for the virus. Over the next 30 minutes, we will separate fact from fiction. We'll identify resources for you, and we'll take a look at the economic impact of this virus. You will hear from survivors and learn just how fast and wide germs spread. Now, as coronavirus spreads, so does some misinformation. So we went straight to the experts to get answers about transmission, treatment, and what products are effective on the virus. Let's set the record straight on coronavirus. The CDC says symptoms of COVID-19 include fever, coughing, and shortness of breath. Symptoms can appear between 2 and 14 days after exposure. While doctors draw comparisons to the flu,
coronavirus is also interesting because it doesn't seem to be quite as infectious as common influenza.
Dr. Shauna Gully with the large health system Centra Health has worked with coronavirus patients during this outbreak.
Many of those people are quite well and have very minimal symptoms and do not need additional interaction with the healthcare system.
But
we do believe in people that are perhaps older or have multiple medical problems or anything that makes your immune system weaker, that coronavirus may be more dangerous than influenza.
Dr. Gully says it's still unclear why coronavirus has been mild in children. So what do the experts say you should do?
First of all, the worry about going and getting toilet paper, I don't think that should be first and foremost on anyone's list today.
And while it is important to be prepared,
we are seeing people come into our environments and take soap, masks, and other supplies home to try to stockpile in their homes. One of our hospitals actually had all of their soaps and hand sanitizers stolen last week.
Speaking of hand sanitizer,
the myths around putting it on your body or on your face is where we get into trouble. Those things are not safe for people to do.
The CDC says people at a higher risk should avoid crowds. Dr. Gully says it's a good idea to keep your space.
We believe that staying about 6 feet away from somebody with symptoms is the most protective space.
As the number of cases grows in the U.S., public anxiety may be growing with it. So don't fear communicating if you're dealing with another kind of medical issue.
If you're an allergy sufferer, I think it's important for you to talk to others about the fact that you have allergies and for them to be a little bit more assured that you're not infective, you have no fever, you have no deep cough, and you have no risk factors for coronavirus.
But if you are experiencing any of these symptoms, the CDC says call your doctor. We're standing outside the University of Nebraska Medical Center. This is a facility on the front lines of confronting coronavirus. Amanda Brandeis talked to one of the patients inside.
Goldman and his wife Jerry couldn't have written a more perfect script for the first 15 days of their Southeast Asia cruise. But the last day marked the beginning of an unpredictable story.
We were fortunate because we had a mini suite, so we had a balcony and could look out at the craziness out there, which was like a scene out of the movie The Andromeda Strain, with 60, 70, 80 ambulances at each time pulling up. The media was all around.
They were among thousands of passengers quarantined on the Diamond Princess cruise ship in Japan. One passenger tested positive for coronavirus and hundreds more followed.
We made the best of it over the 12 days and decided to go public with it at the time and received, tremendous response.
The Southern California radio station owners blogged about their quarantine. Neither had symptoms and felt fine. And while most readers were supportive,
people were beginning to freak, and the worst of social media came out with a lot of vile comments and a lot of threats.
Eventually, a military plane evacuated passengers back to the United States. But on the flight, Carl woke up with a fever. He tested positive with the virus, and doctors sent him to a Nebraska hospital biocontainment unit that looks similar to this one.
No one entered my room without wearing a full hazmat suit. It was like Neil Armstrong landing on the moon, with the air filters tied in behind them and duct tape so that nothing could leak out. 3 layers of gloves.
Now in another hospital room, Carl's on a regimen of ibuprofen and Gatorade.
I've been through every single flavor of Gatorade, multiple amounts of times. This one, the light blue, is the bomb. Stay away from the grape.
He's part of a clinical study, and health professionals swab his room to learn more about the virus. With his symptoms nearly gone, Carl now waits.
This is how they hand me my results on a Post-it note. So that was my last test there, and you can see the NP, meaning the nasal passages. Those were positive. The good news is my throat was negative.
Carl says he's relying on humor and support from the outside world as he waits to receive his final Post-it note. I'm Amanda Brandeis reporting.
People are stockpiling items amid this coronavirus outbreak. The CDC says it is important to have good supply, but unnecessary to go overboard. You may have seen pictures like this showing shelves empty of items like toilet paper and hand sanitizer. So should you do this? The CDC says older Americans and people with underlying health conditions should have a strong inventory of supplies so they don't have to go back to the store. The CDC also recommends families have basic supplies like water and batteries on hand as part of their emergency kit. But remember, leaders say people should avoid buying more than they need. One of the biggest questions that people have is, how do I protect myself and protect my family? The CDC says a lot of the steps are basic, like washing hands with soap for at least 20 seconds. The CDC says to use a hand sanitizer with at least 60% alcohol if there's no soap available. Now here are some more simple steps that you can take. Don't touch your face. Cover your mouth with a tissue if you cough or sneeze, and stay home if you're sick and avoid being around other sick people. The CDC says to regularly clean commonly used surfaces and skip the face mask unless you're sick. Right now, there is no vaccine for coronavirus. We're inside a lab working to change that. And we're exposing just how important it is to wash your hands thoroughly, the demonstration you won't want to miss. Welcome back. I'm Chris Stewart. As doctors here in Omaha work on possible treatments for coronavirus, several companies are working on vaccines. Amanda Brandeis is in one lab where scientists are hard at work.
Kate Broderick remembers the day she heard about a mysterious outbreak unfolding thousands of miles away.
Absolutely, one of those moments that you distinctly remember, probably will forever.
It was New Year's Eve.
Little did I know, unfortunately, that 2 months on and it would be the crisis that it is right now.
The Scotland researcher works at Inovio Pharmaceuticals in San Diego, a company that's made headlines before by creating vaccines for Zika, Ebola, and now the coronavirus.
We really don't have 2 or 3 years to wait for a vaccine. So that's where we come in at Inovio Pharmaceuticals. We use DNA medicine technology.
After Chinese researchers shared the genetic sequence of COVID-19, Inovio designed a vaccine in 3 hours.
We use E. coli to actually make the DNA medicine.
While traditional vaccines use the virus itself, this method puts the DNA inside the E. coli, which naturally replicates the medicine over and over.
So we'll get about like a kilogram of paste. And then from here, you can see it's frozen right now, but it kind of just looks like peanut butter.
The paste is then purified, leaving behind only the DNA medicine, which Inovio hopes to test in humans next month.
Infectious diseases are global. They don't care about boundaries and borders. Everyone's affected from childhood all the way through seniors.
Phyllis Arthur is the Vice President of Infectious Diseases and Diagnostic Policy at BIO, an association made up of about 1,000 companies. She's tracking nearly a dozen bio companies around the globe working on a coronavirus vaccine. She's following 8 companies trying to find a treatment and several others rushing to develop new tests to detect the virus faster. China, Japan, and South Korea also have domestic companies working on treatments and vaccines. Continued funding will also be critical. Broderick says while their Zika vaccine looked promising in humans, it never ultimately got FDA approval for broad public use.
The cases of the virus really steadily declined. The problem for us there was that so did the funding. This is a point in our careers that we can actually truly, literally make a difference in saving people's lives, right now.
If they make it that far, it too would be a day she'll never forget. Reporting in San Diego, I'm Amanda Brandeis.
Coronavirus is having an impact on economies all over the world, and the U.S. is no exception. Thomas Hoppe is taking a look at the impact on small businesses.
The Pacific Ocean market has been a staple of Asian American businesses in Aurora, Colorado for years.
My name is Betty Lamb. I am the owner's daughter, one of the 2 daughters of the Pacific Ocean Marketplace here.
There's such a variety of places to eat, different types of food, and things that you don't normally see in the ordinary market.
Within the last month, business has been somewhat of a roller coaster ride since the coronavirus first surfaced.
With people panicking across the country, we've heard stories in New York saying that there's no more rice, and in Atlanta there's no more rice, so people are continuing to stock up on that.
The outbreak began in China and quickly spread across Asia. Since then, a growing number of coronavirus cases have been confirmed in the U.S., and customers seem to be staying away from Asian American businesses as a precaution. According to the New York Times, business at shops that sell Asian products dropped by 70% in the first 2 weeks of February. The Chinese Merchants Association in San Francisco says foot traffic in their Chinatown district dropped by 50%.
It's a little off and on right now. We're not too sure how it's going to go.
I think it's kind of sad. I think we're panicking for no reason at all.
That doesn't keep me from going out.
From the restaurants we work with, we have seen and heard that they're not doing very good, and that there have been a lot of customers that even loyal customers that haven't been going to their restaurants due to the coronavirus.
Betty hopes that the public continues to be educated and aware. That way Asian businesses can still thrive during these times. I'm Thomas Hoppe reporting.
What is a pandemic? What does one mean for your health and safety? We're exploring that question through animation next. The World Health Organization says coronavirus can be classified as a pandemic. What is a pandemic? What does it mean for something like coronavirus? Annie Taylor's taking a look at the debate.
When people think of pandemics, they might think of a severe disease. But it turns out pandemics have nothing to do with severity and everything to do with location. By definition, a pandemic is the global spread of a disease that impacts a large number of people. Think of pandemics as being at the top of a 3-tier system of classifying infectious disease. Outbreaks are at the base. They happen when cases of a disease suddenly surge past expectations. The flu is an example of an outbreak that doctors expect to see every year. On the second level, epidemics. They happen when the disease involved in the outbreak spreads quickly to a lot of people in a short period of time. They can be local or regional. You'll find pandemics on the third tier. They're basically epidemics, but on a global level. That typically means more infections and more deaths. Pandemics are often the result of a new virus or new strain of virus, according to the Association for Professionals in Infection Control and Epidemiology. It says new diseases spread fast because people don't have immunity. The APIC says pandemics do damage beyond health, saying they also often cause disruption, economic trouble, and general hardship. So what does this mean for COVID-19? There's no specific infection or death rate that triggers a pandemic designation. And U.S. leaders recently said the word is largely up to interpretation. For that reason, different health organizations may declare COVID-19 a pandemic at different times. Experts say declaring a pandemic can get the world on board with finding and funding a solution.
So many of the things that we buy come from outside the United States. So you may be wondering if your products and packages are safe from coronavirus. Coronavirus can stay on surfaces for a few hours or up to several days, depending on the type of surface. But the World Health Organization says it's very unlikely the virus will stay on a package after it's been moved and exposed to different conditions and temperatures. Health experts also tell us the possibility of an infected person contaminating products you're getting is low. If you still think something may be contaminated, the World Health Organization recommends using a disinfectant to clean it. After that, you should wash your hands or clean them with an alcohol-based hand sanitizer. Experts say simple things like washing your hands can help keep people healthy. Next, the visual you won't want to miss, our demonstration that could make people rethink how they wash their hands. Welcome back, I'm Chris Stewart. Amid this coronavirus outbreak, as people work to stay healthy, experts say it's important to remember the basics like hand washing. Russell Haythorne with an eye-opening demonstration.
What we know about coronavirus is that experts say it can live on surfaces like countertops, your hands, or even a glass of water, anywhere from 2 hours to 9 days. So we got this glow germ testing kit to see how quickly germs can spread and how many surfaces they're able to contaminate.
We enlisted these two wild, crazy rascals, AKA my kids, to help us out.
This is the powder-based simulated germs.
We wiped this stuff all over their hands.
Why is it blue? Yeah.
My 6-year-old germaphobe was immediately skeptical.
And we're gonna see how long it takes for this to get all over other surfaces.
Then we let them loose.
I got it.
With one rule, don't touch your face.
Ooh, yeah.
They played catch, ran, and one of their favorites,
Hi. Hi.
grocery store.
I need some pancakes, looks like, and an orange.
Never mind their lack of care loading the groceries. The point is, this is a good simulation of the germs we collectively spread in the real world. And after just 10 minutes of play, we flipped on the black light.
Check out how disgusting the grocery cart is. Just goes to show you how quickly germs can spread. Look at that.
While that's bad, remember those faces we told them not to touch? My 4-year-old had it everywhere. Her mouth, her cheeks, even her little eye. Then we tried the simulated germ lotion.
Rub it in.
To demonstrate how long you need to wash your hands to get rid of germs. What I learned is that my 6-year-old kindergartner has a new song at school.
In the front, in the back, in between, and that's how we get our hands clean.
Experts at Children's Hospital Colorado say you can also hum Happy Birthday twice or sing your ABCs.
And so that means for at least 20 seconds, making lots of bubbles and foam when you wash your hands. So for sure after you use the bathroom, for sure before you eat anything.
What we learned here is almost everything is covered in germs, so good hygiene is your best defense. I'm Russell Haythorne, reporting.
Thank you for joining us for our conversation about coronavirus. We do want to leave you with resources that you can turn to for more reliable information. The CDC has a dedicated website for coronavirus. It updates the page with new information on spread, prevention, and treatments. It also updates the frequently asked questions section. The World Health Organization also has a dedicated coronavirus page with global perspective. It provides information about things like mass gatherings and progress on vaccines. That's all the time we have for our special report, Coronavirus, the Facts. We hope you have a better understanding of coronavirus and where to turn for trustworthy information. I'm Chris Stewart in Omaha, Nebraska.